Today we'll be talking about how ultrasound technology has transformed prenatal care and all the innovations that have enhanced the early visualization of an unborn child. Can you imagine waiting 9 months to meet your baby without ever knowing what they will look like? Well, for generations, that is exactly what parents experienced. Today, thanks to technology and ultrasound, ultrasounds allow families to watch babies yawn, smile, stretch, and even suck their thumbs before birth. These images do much more than just create lasting memories. They have transformed prenatal care and improved all kinds of health benefits for both mothers and their babies. The evolution of ultrasound imaging has evolved from a 2D imaging to advanced 3D and 4D scans, enhancing prenatal visualization and diagnostics. Ultrasounds have helped monitor fetal development, identify health concerns, and support information medical decision making during pregnancy. Um, Ultrasounds also have emotional impact um, as they create early emotional bonding opportunities for families and enhances communication between doctors and parents. This modern ultrasound technology has transformed prenatal care by improving diagnosis, education, and reassurance throughout pregnancy. Even if you have never experienced pregnancy yourself, chances are that you've had a family member or friend who has shared an ultrasound picture with you, and understanding how this technology works, helps us appreciate that these images are much more than keepsakes. They are an important medical tool that has transformed prenatal care. This topic is also relevant because millions of pregnancies each year involve ultrasound examinations, making this one of the most used technologies in healthcare. And also for us, college students, ultrasound technology demonstrates how scientific innovation can improve patient outcomes and support medical decision making, and also affect families in meaningful ways. How the ultrasound technology works, just a second here. Ultrasound imaging principles, um, they mainly work with high frequency sound waves, and they are very safe to use during pregnancy. Unlike x-rays, ultrasounds do not use any kind of um, radiation, so it is really safe for mom and baby. So comparing the different kinds of ultrasound imaging, according to MXR Imaging Educational Guide, 3D ultrasounds create more detailed images than traditional 2D scans, while 4D ultrasounds display those images in in real time. 2D ultrasounds produce flat black and white images, as the one we are seeing in the first picture, and 3D ultrasounds creates detailed surfaces images from multiple 2D slices of clever views of facial expressions. And we have also the 4D ultrasound imaging, which show real-time movement to 3D images, enabling observation of fetal actions like yawning and stretching. The medical benefits and early diagnosis. According to 2019 Society of Maternal-Fetal Medicine guidelines, detailed obstetric ultrasounds are especially valuable when evaluating possible abnormalities. As an example, in a personal story, or during my first pregnancy, we found out that our child has some medical complications. And thanks to the technology of ultrasounds, we were able to take a proactive approach in speaking to a team of medical care that would be able to help us once he arrived. So it helped us feel secure and emotionally prepared, as well as medically prepared for when his arrival, um, at the time of his arrival. Another benefit of ultrasounds is that they help with bonding, reassurance, and emotional impact. Ultrasound viewing helps parents feel a stronger bond and seeing movements and facial features of their baby. They help reduce reassurance and anxiety. Also, sometimes they may create anxiety if some of the findings are not what we wish to happen, but at the same time, as I mentioned, it helps us be prepared for anything that may not be normal, or also just have like a plan, medical plan ready. Ultrasounds are used all across healthcare settings at this moment, and they are not only used for pregnancy, they may be used to detect kidney stones and other things. They do also help for high-risk pregnancies, hospitals. They are used in hospitals, outpatient clinics, imaging centers, and ultrasound to support timely diagnosis and clinically decision making. And the benefits and limitations are the bonding between parents, seeing their baby, not having to wait 9 months to see them. And some of the limitations could be um, just a second here. Some of the limitations can include image quality, which can be affected by different factors such as fetal position, gestational age, maternal body composition, and amniotic fluid levels. So sometimes that might give us different sizes that might not be of normal range. And one of the limitations is that we might receive information that might not be 100% accurate. But therefore, the 3D ultrasounds and 4D ultrasounds is where they come in, and they can sometimes help reassure if those findings are normal or if they are confirmed to not be normal. And well, ultrasound innovation matters because of all the collaboration that can happen between medical care and the parents, impact on patient care as well, and as well as technology advances in imaging, engineering, and medical research benefits for patients. Technology has given families something previous generations could only imagine, the opportunity to meet their child before birth. For my family, when ultrasound provided more than a picture, it gave us time to prepare for my son's medical care. And during my second pregnancy, it has given us reassurance and confidence. Today's ultrasound technology continues to transform prenatal care by improving both medical outcomes and experiences. of families around the world. Technology has given families something previously generation could only imagine. Thank you so much.